So this cat is here today for surgery because it got hit by a car and it dislocated its hip. You can see on this x-ray this hip is normal in the socket and this hip is not normal. It's out of the socket. And we usually take different views to look at it and make sure there's no other broken bones or other issues. So the procedure we're going to do today is we're going to go in and we just cut this part of the bone off, and they get what's called as a false joint. It's a very standard and good procedure for something like this that should fix the problem and make them be able to walk. The surgery is called an FHO, femoral head and neck ostectomy, and we're basically going to remove the head and the neck of the femur. If you think about your own leg, it's where it goes into your hip. We're just going to take that part out. You can see we're draping in the patient here and getting everything set up, and then I'm making an incision and dissecting down in between muscle bellies, and that goes on until we separate the muscles out and get exposure to the hip joint, the dislocated hip. Once we get the dislocated hip cleaned off enough, the bones cleaned off enough to make sure that everything that's critical is out of the way, I use a bone saw and cut the bone. The leg has to be held in a precise manner, which my assistant is doing there, and I'm using a bone saw to remove the part that we're going to take out. After that, I'm using a little rasp just to kind of smooth off any edges on the bone, and then we start sewing up. And so we sew up muscle layers, kind of in the reverse of the way we did going into the surgery. We dissected the muscles apart, and so now we're suturing them back together, and then we suture together the subcutaneous tissues, and then finally the skin. Afterwards, we take a post-operative x-ray to make sure the cut's the way I want it. If it's not, then we go back and do more. But in this case, and like many, we did not. It turned out perfect, as you'll see on the post-operative x-ray. All right, so here's the post-operative x-ray, and it shows we cut from just inside the greater trochanter to what's called the lesser trochanter. You can see it on the other one compared, so we did it exactly what we wanted. Everything's perfect.